The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. We're here today with our episode with Dr. Stephen Roushar. He is a chiropractor specializing in prenatal and pediatric chiropractic.
Dr. Stephen is full of enthusiasm, energy, and zest for life, and believes that starting by living life at an optimal health level is the best way to go. He is passionate about chiropractic and the innate power it gives people to live a healthier, happier, and more advantageous way. Thank you for being here. So happy to have you.
Absolutely.
Well, why is chiropractic care so important or beneficial in pregnancy?
That's a great question. I feel like pregnancy is the only time in a human being's life that their body changes so much in a matter of maybe let's say 2 years, right? Between getting pregnant, first trimester, second trimester, third trimester, giving birth, and then recovering from that birth and breastfeeding a baby and becoming a parent all over again or for the first time. And there are just a lot of physiologic and physical changes that occur during that time. Chiropractic at its essence is meant to holistically look at the body from a musculoskeletal standpoint, first and foremost, making sure that the skeleton is in alignment and it's moving the way it should be, the muscles that move those bones are doing properly, but most importantly that the nerves that come out of the spine are flowing properly to all the organs of the body, whether that be the uterus, the glutes that move the pelvis, or all the other muscles involved there. And so chiropractic is so important during this really vital time of bodily change because it helps support all those changes that are occurring, right? Never at any time, I'm sure, with your guys' pregnancies, have you ever experienced, a baby growing and everything changing, and you have this awesome hormone inside you called relaxin, which is making your joints more loosey-goosey. But at the same time, if something gets locked up or baby gets sitting in an interesting position, that can really restrict some joint mobility there. And so chiropractic is just a really great support during a time when there's a lot of bodily change to make sure that the body is adapting to that growth and making sure that it's staying symmetrically balanced during all that time.
So fascinating. I love the idea that while our body is doing its natural job, we can also help to assist it by seeking out a chiropractor. What are the main things that you are performing for a woman who's pregnant?
When a woman is pregnant, we just go through a set of analyses to make sure that, like I said, everything's moving properly and aligned. First and foremost, we actually do some scans in our office that measure neurologic function of the spine, making sure that those nerves are flowing optimally. One of those is called thermography, totally safe for pregnancy, and it measures if there's an imbalance of heat coming off the spine. And that imbalance of heat is a big indicator if there's something neurologic that may not be working as well in that spinal level. The next set of analysis we do is what's called surface electromyography, and that measures the electrical impulse of the nerve to the muscle right next to the spine, which lets us know if those nerves are wiring and firing as well as they could be as well. And then we do another test called heart rate variability testing, which is looking at the balance of the sympathetic or fight-flight part of the nervous system and the parasympathetic or that rest-digest part of the nervous system. And really the whole show of pregnancy is run by the parasympathetic nervous system, which allows the body to go into that restful state, provides uterine contractions, secretes oxytocin for all that. And so we do those tests, and we do a series of a lot of orthopedic tests to make sure that the actual hip, the femur going into the acetabulum or the hip bone is moving properly. We make sure the sacroiliac joints are moving properly. We make sure the tailbone is in a proper alignment. And then we make sure that the round ligaments which anchor in the uterus to the pelvis and the broad ligament of the uterus don't have any undue tension on one side or the other. And so between all those analyses, it helps us figure out, okay, what can we do to help? And how can we continue to help throughout the pregnancy to help the body adapt to that? And we do gentle and effective adjustments that allow us to balance those things out, whether that be with that traditional popping and cracking, we can do that, or instrument assisted, we do it with what's called an activator, a little clicky tool. If you've ever been to a chiropractor, it provides a little bit more of a gentle adjustment. And then we do myofascial releases as well, which are basically, I always like to call it like a adjustment to the muscle or the fascia, or a massage on steroids. It's not as long as a massage, but it's very targeted, allowing a trigger point or a knot to be released from that area.
You mentioned round ligaments. I hear a lot about round ligament pain in pregnancy. Can you speak to that a little bit?
Yeah, to explain that, I always like to talk about the anatomy of that area to begin with, and it starts with the uterus, right? The uterus is, in my opinion, one of the coolest organs in the human body. It's a smooth muscle, and it's empty until a baby shows up inside of it. And as that baby starts to grow, so does that uterus. And the uterus would completely fall out of the body if it wasn't anchored into the pelvis through two round ligaments, which are about right here, and the broad ligament of the uterus, which attaches at the back of the sacrum. And I like to think of the uterus kind of like a hammock, but the hammock has three string attachments, right? And if those attachments, or if the hammock is sitting scawampus because those rope attachments are maybe shorter on one side, longer on the other side, it can create a pretty big imbalance, and that can make it so the joints in that area aren't moving as well. It can also make it so there's some extra pain in the round ligaments. So figuring out where those imbalances are typically allows that pain to go away as we balance things out. So chiropractic inherently doesn't take pain away, right? Pills can do that temporarily, but chiropractic inherently is meant to help the body function better because it's more balanced, it has better nerve flow, it has less tension in general, and when that happens, the body doesn't experience as much pain or any pain.
And after we come in for that adjustment, feeling great, we've got, we're balanced. It seems like when I have had the experiences of getting chiropractic care during pregnancy, everything just feels awesome for about 4 days. And then after that, I feel like I'm back to being uncomfortable. Maybe it is those, the 3 hammocks that are now out of alignment. Is there anything we can do to retain that great feeling after we've had an adjustment?
Yeah. One of the things I always tell my patients is if you don't want to see a chiropractor very often, become an avid stretcher. Right? We all brush our teeth to maintain our teeth. Hopefully we're working out to maintain good muscle mass. But in order to maintain a good alignment and just overall balance and relaxation, daily stretching is one of the best things that you can do. And there are specific stretches I teach my patients that can specifically help relax and balance out the round ligaments, pelvis in general, the different glutes or deep hip flexor muscles that are all involved with pregnancy and that shift so much when there's a baby inside of you.
If you're comfortable, could you walk us through 1 or 2 of those stretches?
Yes. One of my favorite ones is doing a lunge stretch with a lean. So I can demonstrate that. Hopefully the mics still pick things up. So you just get into it. Here, we'll do it this side, maybe. You get into a deep lunge, right? Round ligament's about right here. So you get into that deep lunge. You lift the arm up, and then you lean over. And then you can really feel that stretch, that round ligament.
Okay.
That's one that people are a little less familiar with.
Yeah.
So that's why I wanted to show that one. One that people are very familiar with is cat-cow. Cat-cow is one of the best ones in pregnancy that you can do to help your pelvis adapt. And then I throw on top of that doing hip rolls. So basically hula hooping on your hands and knees and trying to get every single deep movement in a roll both directions. And that really helps keep the pelvis nice and loose.
Is there a time of day that these stretches are more effective?
I find stretches are most effective after you've already moved a little bit during the day. And so don't do it right away in the morning. And I find the most effective time to do it is right before you hop into bed. Because you're able to decompress from all the stress and movement from the day. Because what puts our bodies out of alignment is stress. And the most easy one to think of, that stress that puts your body out of alignment, is a physical trauma or stress that happens. And that can happen when you fall or when, heaven forbid, you get in a car accident or something really bad happens. Easy, go see a chiropractor if that happens. But then there's little physical stressors that happen to us every single day, right? We tend to sleep in the same position. So the chronic positions we're in, or maybe we always lean to one side, or maybe we're always holding a baby one arm while doing something else. And then the chronic movements that we do as well can put us out of alignment. Those things do it a little bit slower, but it puts us in a pattern. And chiropractic is meant to get us out of that pattern.
That's great. It's so awesome to hear your knowledge and expertise, your passion. You mentioned before we began this conversation that you have several kids. Did that contribute to your passion? How did you get into chiropractic?
Yeah.
That whole story.
Yeah, it's a long story. You guys good for a good story? Okay, awesome. I got into chiropractic as a kid because chiropractic changed my life as a young child. I used to deal with chronic ear infections. I had maybe 8 to 10 a year. Basically, anytime I got sick, it turned into an ear infection. And my parents did the traditional medical model with me for those ear infections, and so I was on antibiotics all the time as a kid. And I ended up getting a couple ear tubes as well, and I kept getting ear infections, so that didn't actually solve the problem. It was more of a button fix, and later to come to find out most ear infections are actually viral. And so antibiotics actually do nothing to get rid of a viral infection because they're meant to get rid of bacteria. Anyway, so it destroyed my gut. But in the meantime, one of my mom's friends told her that she brings her kids to the chiropractor and they never get ear infections. And she was like, oh, I got to try that out. So brought me to a chiropractor when I was about 8 years old. And he found out I had a massive misalignment between my top two vertebrae. And actually the nerves that come out of that area go to the ear. I started getting adjusted and I never got an ear infection again. Still to this day, haven't never had an ear infection. I've seen a chiropractor from that point on throughout. I was a very active teenager, skateboarding, did breakdancing, acting, sports, you name it. And loved going to my chiropractor. I loved the positive experience I always had when I was there. My chiropractor was just a really nice, awesome, personable guy. And B, I always felt better when I left. Whereas you go to those other doctor appointments, not to say they weren't personal and great, but I always was like, to get a physical or I get a shot or a broken bone. It just wasn't as positive or uplifting of an experience. That kind of planted the seed in my mind young that I wanted to be a chiropractor. That it changed my health for a very positive direction. And B, I wanted to do that for other people in some way, shape, or form. So that got me into chiropractic, and I came from a very blue-collar family, so I did not think I was smart enough to go to college. Figured I'd end up doing some sort of manual labor job, which I actually do still, but it required me to go to college for many, many years. Thankfully met my now wife, but she was my girlfriend throughout high school, who helped me do some mental shifts and say, you could go to college if you really wanted to. So she made a really positive impact on me at a very young age to help me shift my mind and recognize that if I could memorize all the players on the Minnesota Timberwolves, I should be able to memorize all the parts of the human body, right? So little mind tweaks at a young age made a big difference. Anyways, went to college, and what got me into more prenatal chiropractic is prior to starting chiropractic school, we had our first. My wife was really excited about doing a natural birth with our first. And so we did hypnobirthing here in Utah with Laura Lynn Curtis. Do you guys know who she is? She teaches the Curtis method. Back then, she just taught just traditional hypnobirthing. And she's such a phenomenal teacher. And we just loved that class, and we were pumped about having a natural birth. And so she was meeting with the Valley OBGYN midwives. And kind of funny story from that morning of when we went into labor with the first child. She rolled over in bed at like 5 a.m. Her water broke a little bit, not completely. And then she wakes me up. She's like, Steven, I think I peed my pants. And I'm like, you did? And she's like, I don't, it's wet, but I don't remember peeing. And I was like, okay, let's go look at it. And I had finished my undergrad, got my degree in exercise science from BYU. So I knew enough about the body. And I was like, that looks like amniotic fluid. This was like 12 days before our due date. So luckily in that class from Laura Lynn, we had learned, some things, because she wasn't contracting at all. We had learned some things to help contractions get moving. And so, we got to the point where the contractions going, about 3 to 4 minutes apart. And so we're like, let's get to the hospital. And so we drove up to the hospital, and they did a vaginal exam, and they found out that our baby was breech. And so that was pretty devastating, as the hospital policy was they only do C-sections for breech babies. They don't deliver breech babies. So we ended up doing a C-section, which was beautiful. And we loved that birth, and we loved that child just as much as all of our other children. But it wasn't quite the experience she wanted to have. Starting chiropractic school shortly thereafter, I started joining prenatal pediatric tech clubs, as I knew I wanted to be a pediatric chiropractor, as I was a kid that got massively impacted and helped by chiropractic, and started to learn about the Webster's technique and prenatal care, and how chiropractic care can actually help with making sure babies are not breech. It's not that we turn the babies, but we create an optimal environment in that everything's balanced, everything's open to allow the baby to be head down and to be delivered that way. So that's kind of what drove that passion for me to really learn about pregnancy and how I could support these women, as I saw how devastated my wife was not getting the birth experience she wanted to have. And I wanted to A, support her for the rest of the children we wanted to have, and B, support any woman in whatever kind of birth she wanted to have. And that's really my goal.
Thank you so much for sharing that story. I love all of the steps that were, a part of pursuing your calling. Tell us more about being Webster certified. Whenever someone is searching for a chiropractor in pregnancy, they tell us you have to find someone who's Webster certified. Tell us why that is.
Yeah, so Webster certification is put on through the International Chiropractic Pediatrics Association, and it's the gold standard for a technique to be learned to support a pregnant woman in allowing the pelvis to be fully balanced, looking at those round ligaments. So the Webster's technique in and of itself is an added technique to whatever technique that chiropractor already knows to balance the body, but on top of it, it's helping balance out those round ligaments and the broad ligaments of the uterus. So it's just looking a little bit more in depth at the pelvis with the context of the uterine ligaments and the uterus itself. And so there are certain checks that we do every single visit to make sure that the sacroiliac joints are balanced, the pubic bone is balanced, the glutes are balanced, the tailbone is balanced, the round ligaments are balanced, and the broad ligaments are balanced. And on top of that, you learn other techniques that help release the ribs and that help release the other parts of the spine, the lumbar spine, that are integrally connected with that. Not only that, actually your neck is integrally connected to that, because the nerve that actually stimulates uterine contractions is called the vagus nerve, and that vagus nerve actually comes out of the top of the neck and goes internally all the way down to the uterus. Yep, the Webster's technique is all about that. It's taught by the ICPA. It's actually kind of the entryway into prenatal care, and the ICPA teaches a 20-course certification that, like I said, there's 6 of them for perinatal care. So not only do you learn how to take care of a woman in the first, second, third trimester, but also postpartum, as the bodily changes shifts. All of a sudden, a woman's getting engorged to be breastfeeding a baby and is holding a baby all the time, and then this area is recovering, shrinking back to where it was used to being. And so it covers a lot of those things and all the different health concerns that could occur during a pregnant woman's journey, and how we can support them through that, whether that be preeclampsia, whether that be postpartum depression, whether that be SPDs, pubic bone dysfunction of some sort. And that whole certification course really gives a great base knowledge from a understanding physiologically what's happening, mentally what's happening, physically what's happening, even chemically, hormonally what's happening. So it builds a lot of context for that, and then we learn techniques all throughout those certification series to be able to adjust our technique to those different women, different body types, and different phases of perinatal time frame that allow us to be able to help and support women, and kids for that matter, with those 16 courses. Kids need much more gentle adjustments when they're infants and when in their first really 8 years of life.
We'll speak to that in a moment. But before we move on, you mentioned SPD. We talked about round ligament pain. Could you talk about SPD for a minute?
Yes, SPD, or people like to call it lightning crotch. So it's just incredibly intense pain that happens right here. When a woman's pregnant, she has this awesome hormone inside of her called relaxin, which allows the body to grow and change and shift. And it relaxes those joints and makes them actually more mobile, which is amazing during childbirth. Kind of sucks during pregnancy, but also necessary to allow that shift to occur more comfortably. But with that, it can be more easy for that pubic bone to become out of alignment, or for pressure to be put on that pubic symphysis. So the pubic bone, you can think of it, and I'll show you like a little joint right there in the front of the pelvis, and then there's a soft disc in the middle called the pubic symphysis. What happens when a woman is pregnant is that area gets a little bit more separated, and if the pelvis is out of alignment anywhere, because the backbone there, it's called your ilium, is actually right attached to that pubic bone. If that shifts out of place, that can put a lot of pressure on the lower end or the top end of that pubic symphysis, and that can cause a lot of pain because there's a lot of nerve endings in that area. And so when that's out of alignment, it can cause pain, and when we get it into alignment and we allow that joint to grow and adapt to that pregnancy a little bit better, the SPD tends to go away. But it takes a full analysis of the pelvis. It's not just simply, yes, we can adjust the pubic bone, but typically it requires an adjustment on the femur, it requires an adjustment on the SI joint, it requires some round ligament releases in order to allow that area to chill out, get pressure off of that. And not to mention, sometimes it's because that baby's sitting in a really weird position. And so again, those uterine releases can allow that baby to be in a more optimal position.
Incredible. Well, I am just picturing your subsequent children and just being married to a chiropractor. How did that change and enhance things as your wife continued to?
It was awesome. I wish Marie was here to speak to it, because I don't like to brag too much. But yeah, It's awesome being a chiropractor for my own children and for Marie, right? She can wake up in the middle of the night, she's like, oh, something's uncomfortable. I'm like, oh, let's check it out. And, we can get her adjusted right away. And yeah, she has really comfortable pregnancies, and we have 5 kids. And being pregnant is not the thing that she's, afraid of. It's for having more kids, it's like, oh, how do we manage and juggle another one? That's what happens when you add kids. As you guys know, both having 3 kids. Juggling's not easy. So anyways, yeah, it's awesome being a chiropractor, raising kids. It's funny because my kids tend to wake me up in the middle of the night with stuff. Like, Daddy, I have a headache. Daddy, something's wrong. I tend to be the first person they turn to, and it's just really fun. So.
Can we talk more about pediatric care?
Yeah.
It's not very often that you find a recommendation to take your infant or your baby to a chiropractor. Tell us how that's beneficial for them.
I recommend everyone brings their infant to a chiropractor because we can set these kids up in a proper alignment right away in life. It's awesome, right? And so many people bring their kids to their dentist and to their pediatrician regularly because they understand that they're looking at their child through a specific scope or lens, and they're going to help them in their respective way. And as a pediatric chiropractor, we can help infants so much. We do a specialized set of tests on kids, checking out for proper mobility. And you'd be surprised at how many motion restrictions we find in infants, or something like maybe their pelvis is just a little bit out due to maybe how they sat in utero or during something traumatic that happened during the birthing experience. Often find misalignments in the neck. And so, yeah, we go through a set of analyses checking to make sure that your infant's bones are moving properly, their joints are moving everywhere, the head's turning all the way, leaning this way, that way. That alone can resolve several breastfeeding issues, colic issues. It's just checking to make sure that there's no motion restrictions and your infant is comfortable. We do the same thing for the low back and for all the joints of the body for that matter, the shoulders, the elbows, the hands, the feet, the knees, the hips. And then we check the alignment, make sure everything's aligned. And one of the most important things that we do is we check the nervous system. And we go through a series of 20 primitive reflex tests. Are you guys familiar with primitive reflexes? Primitive reflexes are the reflexes your infant is born with. The rooting reflex, right? When you tap they should turn towards that so that they can suckle. The suckling reflex, right? When you put something in an infant's mouth, they should suckle, they should wrap, and they should tug. When you put something too far back in an infant's mouth, they should gag. And they shouldn't gag when you touch the roof of their palate, and some of them do. And they have what's called a hypergag reflex. They have a grasp reflex where you put your finger in their hand and they should grab on. They do that with their toes as well. And there's several others. So we go through that series of tests and make sure that those nerves are wiring and firing well, because those nerves come out of areas of the spine, right? The nerves that come in the hands come out of actually the C5, 6, 7, 8 in the body, are the nerves that come out of that area. And if those nerves aren't wiring and firing the way they should be, that can really inhibit that. Not to mention, we're talking about breastfeeding, the nerves that go to the tongue, the cheeks, the mouth, the jaw, all those areas that are incredibly instrumental in allowing a baby to breastfeed successfully come out of the top 3 vertebrae of the neck. And so we can really help with breastfeeding outcomes. I won't lie, my favorite infant to work with is a colicky infant, because that is so disruptive to A, the infant's life, but B, the parent's life. It is very hard. And I know from personal experience with our C-section baby being very colicky and how chiropractic can help with that. I love working with these kiddos because A, we're able to get these kiddos more comfortable, and we're able to read the body and figure out why they're uncomfortable. Definitely more times than not we're able to do that.
What does a care plan look like for an infant? Is it coming 2 times that first 2 weeks of life, or is it ongoing care?
Yeah, so care plans are all focused on reintegrating the body to heal the tissues so that they can be healthy and well. And our tissues in our body, right? We've got our skin tissues, we got our muscles, we got our bones, and we got our nerves. And tissues all heal at different time frames. And my care plans are set up to help the tissues of the body heal in the proper time frame. So if we just find muscular or bone stress, we're typically doing a care plan for about 1 to 3 months. If we find neurologic stress, we set up a care plan that's at least 6 months. Because nerve cells take at least a 6-month time frame to fully regenerate and be able to completely heal and get that proper amount of nerve flow. And when I talk about nerve flow and misalignment, I always like to use the garden hose analogy, right? With your garden hose, water flows very seamlessly from it when it's not impeded. But if you kink it, that can completely stop the flow. Or if you put your thumb over the water hose nozzle, which is a better analogy in my opinion as to what is happening to the nervous system, the water sprays everywhere. And so if that nerve is getting continuous pressure on it and there's so much neurologic activity happening, It's like rapids happening in your child's spine. And if we can calm that down, get everything flowing neurologically very smoothly, that allows for proper healing and being set up for success. And so care plans, if I find neurologic stress, tend to be about 6 months plus long for an infant. But yeah, it really depends. I always take into account my patient's goals and the exam that I do. And all my care recommendations are based on how we can get my patient's body as optimally functioning as possible from an alignment, tension, and neurologic standpoint. So typically those start out 2 to 3 times a week, because we need to do some continuous care to retrain that body to actually hold in alignment, kind of like exercising the spine into a proper alignment. One adjustment can do really good to free up those nerves and those muscles. It can be awesome. But if you don't have that continuous repetition, that deep tissue healing doesn't happen. And so our care plans are set up for that while taking into account our patient's goals. And if they are just looking for a few adjustments, we're just going to do our best in however few adjustments we can do it in. So we always try to take that into account as well, and finances and all that stuff.
This conversation has been fantastic. I am definitely more aware of the benefits of chiropractic care. Is there a way that we can spread this knowledge further? I just wonder how more people can hear about this.
Yeah, I mean, that's what we as prenatal pediatric chiropractors are really trying to do, is, whether that's through our social media, through our internal communities, through our patients teaching other people about the benefits they've seen. And that's really what I think is the best, just word of mouth, right? It's awesome that you guys are doing that podcast. I mean, that's literally what you're doing right now, is you're helping people become more informed. And when we're more informed, we can make better decisions. And I'm sure you guys have learned that, and me as well, as a parent. It's like, man, if only I knew what I didn't know back then. Mm-hmm. And so I love that you guys are doing this. It's one of my passions as well, to educate and to teach and to help people become empowered. Empowered is a really important word for me, is I want people to be empowered with knowledge so that they can make the right decisions in their healthcare. And that all comes down to informed consent as well. Is too often in the medical field, people say, you do this, you do this, you do this, and they don't tell you why and how it can benefit and what it's actually doing. And in order to have true informed consent, you need to know the benefits, know the risks, know what's actually physiologically going on. And that is one of my passions, is really helping my patients feel empowered in the health decisions they make, whether that's in my office or that's with other practitioners, as I try to help educate them on what they're getting into, what that medication is, what that therapy does, and how it could help in the meantime, or how it could hinder in the long term.
Well, I know that we feel empowered. I know our listeners are going to feel empowered and want to run to their nearest chiropractor.
Awesome.
Are there any resources that you love to share with patients, either a book or an expert, or, like you were mentioning, stretches, anything that we can do to improve our bodies and our alignment during this time?
Yeah, from a chiropractic standpoint, if you're looking for a Webster certified chiropractor, you can go to icpa4kids.com, and the 4 is a number 4, or you can just ICPA find a chiropractor. And on that site, you'll find all the certified chiropractors that have gotten additional training to be able to work with pregnancy or with kids. And that's a really great starting point when looking for a chiropractor. Also, when looking for a chiropractor, I think every chiropractor gets at least some minimal training in working with a pregnant woman. You get one class, at least at my chiropractic school, that was a women's health and pediatric class. So it was like half the semester was women's health and prenatal care, and the other half was pediatric care. And so you get 1 semester of training, all chiropractors, so that's kind of baseline. But to really find a good chiropractor that works and really understands and is passionate, and for me, I personally love working with people that are passionate about whatever it is. If it's an accountant, a doula, I just want to work with someone that really cares. And so I say call the chiropractors around, interview them, see what they have to say, see if you vibe with them, and ask them, like, hey, is your office set up for kids and pregnancy? For example, all of our tables are set up for pregnancy. Tummy drops down, and so a pregnant woman can easily sit in the table or be in the table without any discomfort. In fact, they're like, can I just lay in here for a while? Because they get to lay face down pretty neutrally. We have a mother's room where moms can change their baby's diapers, they can nurse in privacy, they can nurse in public. We are open to whatever. And we kind of have an open concept, and there's a kids area. And so our office is literally built with pregnant women and children in mind. So some chiropractors have maybe those like electrical stimulation type units, and those heat packs and things like that. We don't have a lot of those because there's kids running around our office all the time and we don't want kids to get injured. Figure out if that's the type of provider that you want chiropractically. Figure out if Webster's certified is what you want, and that's a great way to find things. Otherwise, there's so many great resources out there to support you through your pregnancy. I recommend every woman take at least a birth class once. I'm a big fan of hypnobirthing, and so I think it's just a great way to empower a woman to understand what's happening in her pregnancy, postpartum, and to be prepared for delivery. I am a big fan of doulas, a huge fan of doulas. Impact personally by having doulas at our births, and I know for a fact that you're going to get a better outcome if you have a support member there that can be part of your village, to be right there with you, hands-on. Otherwise, having a really great lactation consultant postpartum is vital, especially if that breastfeeding doesn't come as intuitively or naturally. And if you're here local in Utah, big fan of Jill Lancaster, the lactivist. She's really great. Good pediatric dentist is really awesome. Dry Creek Pediatric Dentistry. There's a lot of doulas I could refer people to. There's great hypnobirthing. Crystal Lyon teaches hypnobirthing in my office. She does a five series class. And yeah, we've got prenatal massage therapists in our office as well. Oh, I have so many resources for pediatrics, kids. Brittany Fox, I want to give her a shout out. She's really awesome for postpartum hormone care. Resources are abundant, and personally, I want to find people just as passionate as me. And so I've found those people, whether it be a pelvic floor physical therapist, dentist, midwife, doula, that I know I can confidently send my patients to, and they're going to get an all-star experience.
Well, we have had an all-star experience today. This has been such a fantastic conversation, and we'll link a lot of those resources in our show notes too for our listeners.
Perfect.
I love that you have the team of people. It's all interconnected, and we all need those resources, so that's fantastic. One thing we do every episode is we share a Mom Squad secret from someone in our community. So this is Tina, and she says, don't be afraid to speak honestly about your expectations, desires, and fears with your partner, provider, and children throughout pregnancy. These conversations will be the platforms for honest communication, healing, and prosperity.
Love that.
Yeah.
That's beautiful.
Dr. Stephen, thank you for coming on the podcast today.
You bet. Thanks for having me. This was a pleasure. These ladies are awesome. Keep
you.
listening.
Thank you. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.